This is the back of the skeleton. So he's facing the door. And you can see down here at the knee, you can see the back of the femur and the back of the tibia and then the fibula. And the fibula makes a joint up here called the superior tibiofibular joint. And then you can see it makes a joint down below at the ankle. Okay? So my client has episodes of left knee pain, and he shows me how he pops a joint somewhere in your ankle, or is it around your knee as well?
The ankle mostly, and sometimes the knee.
Okay. I have evaluated all the joints in the foot and ankle, and they all have good mobility, and at the end of motion I can still overpressure and get a little bit of spring. I tested up and down movement of the fibula, and that motion was good. But when we come and test the fibular head, let me shut that curtain because we have too much sun on you. So when we palpate the back of the fibular head, and I contact it and I load it to take up all the easily available movement, called taking up the slack, and then I spring it, it has mobility. On the left side, I'm not able to take up that slack. I'm pushing rather firmly, and I'm pushing straight down, just absolutely slightly laterally, and I cannot take up the slack, and I can't spring it. So regardless of how it looks, it behaves as though it is posterior. So I'm going to lean on it at this angle to get a little bit of lateral distraction, a little bit of gapping of the joint, and then I'm going to just lean on that. And I'm going to do that slowly over the course of 3 minutes. And it's very easy for him to do this to himself. I don't think this pattern will come back. I think once we restore the normal motion, I think it's going to stay. But he can half kneel and then use his hand and then just capture that back of the fibula, the fibular head, and just push it forward and outward gently for 2 minutes. So I'll actually have you do that once a day for a week, and then do it once a week for 4 weeks. I have no evidence that the joint is unstable. There's no history of severe trauma to it, so I think it's going to do fine. I'll stop filming and I will treat it, and then we'll come back and show the response.